Hello, good morning, everybody. I'm so glad that we're talking about mental health with a group that has all age groups because it's relatable, it's very, very regular in our daily lives, not just when there's a mental health crisis, but in general, just to have a happy state of mind is something that we all have been talking about, but perhaps don't really identify when we're in the situation, when we're in the crisis. And therefore, my question to start this very interesting and intriguing session, Dr. Dhamija and Dr. Nagpal, is the fact that what really is mental health crisis? When do you know? Because I'll tell you why I'm asking you this. I believe there are three segments, three groups in our society that talk about mental health. The one is the older generation who say, अरे तुम लोग को नहीं पता है, हर बात पे तुम लोग स्ट्रेस ले लेते हो, क्या है ये लेबल्स लगा देते हो. Then there's an age group which is mine, who's unsure. They know कि कुछ चल रहा है, but they don't know what to do, or maybe they don't have the time to go to a therapist, a psychiatrist, a psychologist. Then there's Gen Z, the younger ones, who are openly talking about it, who are not shying away from going to a therapist. So when you have such varied age groups with such varied understanding and perception of mental health, where do we stand? What is mental health crisis, and how do we identify? At what point do we know we're going through a crisis? Dr. Dhamija.
Good afternoon, everyone, and thanks for having me and Dr. Nagpal, and having mental health at the forefront of this conclave. You rightly said that it's an invisible pandemic, and recently the Supreme Court of India, when they were constituting a national task force on mental health, called it an epidemic. And this is something which we need to understand, that we are exposed to so many of factors, including environmental, including social, including economic, including medical, including financial. And these are coming up from all fields, and we are all exposed to this from the infancy to the first, let's say, 1,000 days to the last 1,000 days, all age groups. In the era of digital era, we are bombarded with information all around, and that is again causing a reactive and a kind of a response to this all information all the way. In addition that there are basic mental health disorders. We all have numbers in India, whether it is National Mental Health Survey, the current being already ongoing from National Institute of Mental Health and the Mental Health and Neurological Sciences, Bangalore, and from IBHAS and from AIMS, Delhi. So where I come from, Institute of Human Behavior and Life Sciences is one of the largest mental health institution in Asia. So we are the largest neuropsychiatric hospital, and we have more than 3,000 people coming every day in our outpatient clinic. So you can see the numbers. That is one hospital, and the numbers are quite high. People need to understand there is a need for mental health interventions, but there is less demand. So we need to create that demand. We all understand there is a problem, but how many people come forward to seek the professional help? So that is where we are lagging behind, and that's the stigma. That's the mental health literacy, where we can work upon, and conclave like this are very important in creating awareness amongst the masses so that people can come forward and seek professional help.
Dr. Nagpal, the same question to you. And in fact, I want to understand from you whether mental health crisis has been rising over the years, or we're just becoming more aware. It was always there, but now we're becoming more aware, and we know what each situation, each crisis is called.
Thank you. Thank you, all of you. I think, first of all, it's intriguing that such a topic is being taken up on a multifactorial and also multidisciplinary forum. Two aspects come to my mind, taking the clue from what Dr. Dhamija mentioned. One, mind as a component of day-to-day health has often been ignored, neglected, and condemned as you grow up in a stereotype, stigmatized society. Second, mind as a complement to physical health and not competitive to it. Two factors have influenced the acceptance of mental health in a culture which has 3,000 years of mental health capacity building. The Indian knowledge systems, the Panchakoshas, the Varunas, and the Doshas, So that's one point. Second, what brings us closer to a invisible pandemic? India accepting it. India accepting it without stigma, with awareness, with professionals coming up in a big way now. The reason is, we also believed in about 25 years, the new millennium now, that non-communicable problems, non-communicable disorders, जो हम पहले सोचते थे कि Western concept है, hypertension, obesity, diabetes, cancer, drug abuse, depression, what else? Road traffic accidents. When the data came in, and we were destined to be one of the capitals in the world for all these, you go and see the data now. Obesity, we are a pandemic. Cardiovascular disease, we are a pandemic. Then I think our thinkers, our policymakers have also realized they are all, majority of them are human behavior related. You won't find many of them in rural settings. The urban India pandemic is also non-communicable disorders in which mental health is leading now. Because my obesity, my cardiovascular, my cerebrovascular, my dietary patterns, we heard 3 questions just now, is influenced by the way I think, feel and behave. If mind and mental health was in the dock, in the storehouse of the policy, one reason was that we had to struggle with survival with communicable disorders in our country. We spoke about dengue, we spoke about chikungunya, COVID. We survived, we thrived, we are happy. But now let us look into mental health because it cannot be ignored anymore. We are leaders in the world in terms of human resource. Tell me, where else in the world you have 1.4 billion people and at least about 60 crores of young people beginning to be leaders for movements like mental health, for gender? It's in India. The tragedy was that we were not having mind and mental health as a component of day-to-day life. And the 3 reasons given in most of the research in India was stigma, stereotypes, ke ye to pagal hai. Condemned, denied, ostracized and neglected. Second, lack of awareness, jaisa maine aapko bata diya. Third part being very important, what sir said, lack of professionals. Where were the professionals? A country that has a 3/4 psychiatrist, not even one, a 3/4 psychiatrist for 1 lakh population, and the world average required by WHO is 3. It will take us years. Second, a total number under the Indian Psychiatric Society and the clinical psychologists available to understand, treat, manage, recover these people who suffer unnecessarily because of mental health disorders are just about 15,000 people. And we need about 5 lakhs of them. So now, post-COVID, it became a visible pandemic, lasting more than COVID. So now I think the government has taken up seriously. The Prime Minister talks about in Pariksha Pe Charcha and Man Ki Baat, how mind and components like mental health influence us. So these are my preliminary comments, I thought.
You know, I'd love for my parents to listen to you, Dr. Nagpal, because at some point in life, I wanted to become a psychologist and they were very hesitant. So, you know, I completely relate to what you're saying, that there has been a hesitancy in sort of letting your kids and letting your family members and loved ones go into that field. But Dr. Dhamija, since you so closely work with students, with youngsters, you're associated with UGC, you're also part of the Supreme Court appointed National Task Force for Mental Health. What is it in youngsters and students that is leading them to a mental health crisis? Is it just the digital era that we are living in? Or is it also a generation gap that we as adults are not able to understand what they're going through? We haven't sort of, you know, filled that gap for them.
So I think there's multiple factors. They're all combined together. Recent data shows that there has been 80% increase in the suicides in students over last 10 years, 11 years. In fact, if you go through the numbers again, many of the educational institutions do not have the mental health care access. Even the 50% of the institutions, universities, institutions of higher learning did not have sensitization of their faculty in last 18 months when the Supreme Court mandated task force was preparing the report and interacting with the faculty, students and all the stakeholders. So these are very, very alarming numbers, and of course, there has been a lot of work being done now. The University Grant Commission has come up with, it's coming up with the guidelines. I'm the chairperson, Dr. Nagpal is also working with us as a member. So we are coming up with the guidelines for all the universities in India to work on mental health, to create an ecosystem in the universities or institutions of higher learning which are mental health friendly for the students. I'll share our own experience from IVHAS in Delhi. So we adopted 30 government schools a couple of years back, where we provided the counselors, we provided the screening of the students, we interacted with the teachers and the parents. So, and of course the professional help if required in the hospital. So our experience was that even the parents and the teachers both were resistant. They would not like to talk about the mental health issues, the barriers. So we came up with the reportage, barrier and challenges of school mental health initiative, what we call them. And it was very difficult to convince them that this child needs help, or he has anxiety, or he's facing bullying, or he's facing the other anxiety problems, or with the competitive. So I think there are many factors, whether it is the institutions, or it is the parents, or it is the academic pressure, or it is the ecosystem, or it is the digital era. So there's something which needs to be done at all levels. And I think the government has taken initiatives, but it's also important to civil society to take up this.
Yes, and that is why I think mainstream conversation about mental health is extremely crucial, and that is why we're having this conversation. Dr. Nagpal, perhaps in the last few years, we would have said that, look, people who are from underprivileged background, or people who are going through some sort of difficulty in life, they are the ones who go through mental health problems. But that is not true today. Now we know better. We know that people from well-to-do families also suffer through mental health crises. That sort of myth has busted, right? Do you see that when you're meeting with people? How often does it happen, that entire gap having been completely closed now between the rural and the urban?
Needless to say, thank you for picking up this question. I think we are here with the thinkers of the country, and I'm sure, I was just talking to Sir also, the divide is huge. It's a gorge. Urban mental health crisis and rural mental health scenario, I would call it. It's a scenario there. It's a crisis here. 15 to 45 years, आपने बड़ों की बात करी, बुजुर्गों की बात करी, they are happier, healthier, smarter. I see, by the average, today morning I've seen 2 students. One from a Delhi college and one, of course, still preparing for the NEET exam which got postponed. Doesn't want to give up. Parents don't want to give up, the child wants to give up. Now why? The question is competitiveness, pressure, fantasized pressure, the power of packages and placements in life, and also the cutthroat survival in the apex institutions of urban setting. You tell me by your wild guess, what are the number of suicides in the IITs of India? Anybody? Just Google it. Only 25, 26 IITs. The best institutions in the world we have. One, because the emotional intelligence is never seen for the last 25 years as equally competitive and complement to the IQ. Highest IQ kids of our country have the highest rates of suicides. Why? Don't we have to answer it for our younger generation? Otherwise they'll turn around and say at Viksit Bharat time, this is the world you gave me. Parental pressure, I'm sure you didn't have that. Parental pressure, survival, otherwise get out. That is a feeling a child has in urban India, not generalizing. The ones which we see, I'm sure Sir also comes across. So my question remains, to tell you very honestly, helpless ho jate hain, because we were not prepared for this crisis. 16-year-old takes an appointment and says, okay, I say, mom or dad, anybody can come along? Doc, why do you want my parents? I'm taking an appointment. I don't think they're worthy of coming along with me. What do I do? So that's urban India. Let's be prepared. Let's accept it gracefully and generously also, because the young India is wanting mental health to be discussed as a platform. I was telling you, sir, we have the Mind Smart program. It is in higher education. It is in school education. More than 10,000 schools have benefited. There are peer ambassadors of mental health. Life skills is a terminology for school education now. So India is very progressive. But your question is answered in one line, that urban India has a mental health crisis. One, because the loneliness epidemic is in urban India. Let's check out. WHO has brought in the terminology of loneliness as being the invisible epidemic, depression being the visible epidemic. Uska manifestation jo hai. हम भीड़ में हैं लेकिन इतने अकेले हैं. Talking at home, chatting at home, conversations at home, zero. Teenagers grow up in a lonely environment. Many people you must be knowing. They grow up in an environment where they are latchkey children, double income, no kids, wo bhi fashion hai, and also having maybe kids where they want to help parents do good parenting. That's urban India. There's so many people who come to us and say that, yes, can I run a campaign? I'm talking about teenagers, about good parenting for my own parents. So I think it's a beautiful opportunity for human resource in India to minimize the urban mental health crisis. And I think worthwhile to share a data over here. 11 out of 100 Indians are at the moment in need of tertiary mental health care intervention, yani ke diagnosable hai. And 14 years is the peak point of, remember, teenagers. 14 years out of whatever may be our life expectancy, say 80 plus, is the peak point in India where mental health conditions are showing the flag signs and the warning signs.
Okay, Dr. Dhamija, you wanted to add?
No, I'm just continuing with Dr. Nagpal said. A couple of years ago, we were at IIT Gandhinagar, both of us, sent by the Government of India, the Ministry of Higher Education. And we had this 2-day workshop for all the directors of IITs in the country, deans and directors. The day we were discussing how to create the ecosystem in IITs, same day, the suicide happens in IIT Delhi. Same day. So you can imagine the people, the high caliber competitive students coming to IIT and finding everybody over the same level. And then you have to come out of that, see that this is something which we have to struggle and survive. So the individual pandemic is not only at the periphery level, it is at all levels. We deal with many elite schools in Delhi also, the elitiest of school. And in those schools also, there is a EWS category, there is other category. And we find equal number of issues, whether it is bullying or it is anxiety or it is peer pressure or it is apathy. The apathy of the students, apathy of the teachers, apathy of the parents. The lack of redressal mechanism at the schools. All these things are contributing to the rising number of the suicides in the students, whether it is Kota or it is somewhere else. So we are struggling to come out of this, and I'm glad that the government is taking the steps, but at the same time, a conclave like this is very important to bring out that awareness, that campaigning, that this is something which we need to talk about. It's okay not to be okay.
Yeah, absolutely.
That is very important to see.
Yeah, and I think it's very crucial for all of us to believe in it. Before I take this conversation forward, we have a message from the Health Minister of Bhutan. Let's listen in. Remember, Bhutan has been topping the happiness index. We all can learn something from them. Let's quickly listen to that.
Namaskar. I am delighted to join World is One, WION, and would like to extend my warm greetings to viewers across India and beyond. Today, I would like to share Bhutan's health sector journey, the progress we have made in improving the health of our people, and the invaluable contribution of Bhutan-India cooperation in advancing our shared goals of health, well-being, and sustainable development. Health has always been a national priority in Bhutan, guided by our visionary monarchs and enshrined in our constitution. Bhutan's healthcare system is founded on principle of universal access. Every citizen is entitled to free healthcare services, including both modern and traditional medicine. This strong foundation has enabled Bhutan to make significant progress over the years. We have achieved notable improvements in maternal and child health, maintained high immunization coverage, and successfully controlled many infectious diseases. Like many countries, however, Bhutan faces emerging health challenges. We are experiencing growing demand for specialized healthcare services, attrition of skilled health professionals, infrastructure gaps, and rising burden of non-communicable diseases. To address these challenges, Bhutan has embarked on important health sector reforms since 2023, focusing on strengthening governance, improving primary health care, promoting innovation, strengthening medical education. Our primary objective is to ensure that quality health care remains accessible, equitable, and sustainable for future generations. Throughout this journey, India has remained Bhutan's closest and most trusted.
Dr. Nagpal, what can we learn from Bhutan?
I'm so happy that Sir also mentioned about the non-communicable disorders. And right now in the panel we are discussing mental health, which is a leading non-communicable disorder in the world today. One, because it is largely invisible. Secondly, it has a manifestation both as an isolated mental health problem and very largely as a manifestation of our physical disorders also, isn't it? And it's heartening to see robust policies coming up in India now. I'm very happy to see that partnerships are evolving in the education sector, social justice sector, and women and child development. The three ministries directly working with the health ministry. Education, Sir has already mentioned. India boasts about 16 lakh schools, little bit more than children in Switzerland, I believe. 5.2 lakh schools are only higher secondary, that means +2. Can you imagine the great human resource of young leaders to transform the perception about mind and mental health? And that is happening. The school mental health policy is likely to come in. University mental health policy, both of us are there in it. Iska matlab kya hai? Every institution has a role to play in promoting well-being of an individual and groups who study there. Because these are the people who will matter 30 years from now. The students who come out, they will be part of the business world, the policies and the media world also. But the ones who are already into the gamut of 11 to 14% of disorders, I think at the moment very much important is destigmatize, demystify. Destigmatize and demystify the mind. ये mysterious नहीं है. ये heart, lung, kidney और liver जैसा ही है. Except that it also can think, feel and behave. Unlike liver and kidneys. It can think, feel and behave. So उसको mental health कहते हैं, brain का part जो है. Why can't we give it more importance for those people who are already suffering, like you said, ma'am, the elderly people, neglected, condemned, sometimes ignored in the society. I believe we are the largest, in short years, few years, we are the largest geriatric population in the world. Young तो हैं ही हम सबसे ज़्यादा. इनका क्या होगा? How many of you come across requests for addresses of old age homes? I come across every week. You go from Delhi to Jaipur, look at the number of old age homes, luxury homes coming up. Fine, जहाँ needed है, neglected है, अकेले हैं, ज़रूर जाइए वहाँ पे. But I come across families, ma'am, who have got 10 members, mansions to live. They still want old age home for their parents and grandparents. Where are we as India? We are supposed to be the great Indian family system. So children are the change makers. I've come across youngsters telling me, no, I don't want grandpa to go to an old age home. I'll take care. Nanu, Dadu, मेरे साथ रहेंगे दोनों. कितना अच्छा लगता है. I thought they are the ones who will change the world. Let's give them the Rajduts, the ambassadors for tomorrow. So that's what the Mind Smart program does. So people who are already suffering, ensure that they reach out to help. Help available है, कम नहीं है. But hospitals कहाँ जाना, किसके साथ जाना, कौन लेके जाएगा? At times, family members need to have time to take somebody to a psychiatrist or a psychologist, no? They can go to a cardiologist, they can get a stenting done, they can get a liver transplant. But what about depression? कोई organ बचेगा नहीं ना अगर वो suicide कर ले तो. क्या फ़ायदा होगा? I'm only looking at those people who are already suffering. So I said demystify and destigmatize the mind. Third part, very important, decentralize the services, which the government is doing flamboyantly. Primary health care is coming up in a big way, and we are very happy that the general duty medical officers, the MBBS curriculum today, the Anganwadi workers, the ASHA workers who reach out for immunization in the villages, they have modules on mental health now. Isn't it, sir?
Yeah.
They have modules on mental health. And That means we are a very fast-moving country. We have problems, no doubt. We have 1.5 billion, which is going to be now in the next year census. But I think thinkers like all of you, with more and more platforms to discuss, to aggressively come forward, the corporate social responsibility for mental health has to come in huge, billions. Have you read the WHO's report? $1 trillion is the global burden of economic loss because of mental health world over. And today, the Indian Economic Survey has come. Today means just a few weeks back. I think some of you may be knowing it. They say that absenteeism, there is something called presentism also. I'm present but not present in the office, not working, because I'm suffering something wrong in my head. So presentism, absenteeism, inadequate work, either from home, and decline in my overall productivity in life is what Indian Economic Survey says is mental health suffering in the workplace. So let's help our colleagues, our friends in the workplace also. So if Economic Survey can do it, the happiness index can do it in Bhutan, why are we waiting for making mental health conversations a family time, a work time, a lounge time in the office, in the schools, in the universities, and in even places where angels fear to tread, even in asylums. There are no asylums, no word called asylum anymore. It is stigmatized. But mental health hospitals से दूर से निकल जाते हैं. हम क्यों? Because हमने उसको एक हवा बनाया हुआ है. So I think these are the cultures we need to develop. The government is doing it. I'm sure Sir has more to add to the culture of accepting mind as a societal phenomenon, not as a boardroom phenomenon or in the hospitals.
Dr. Dhamija?
No, you are absolutely right. In a hospital like ours, लोग आधा किलोमीटर दूर गाड़ी खड़ी करके आते हैं कि कोई देख तो नहीं लेगा कि मेंटल हॉस्पिटल में क्यों जा रहे हैं. So the hospital which used to be called as Mental Hospital Chadra is now Institute of Human Behavior and Allied Sciences by the Supreme Court order that you will remove the mental health word from this. So I think these kind of initiatives are very important for destigmatization and something like this. But I'll tell you something more about what Dr. Nagpal was alluding to. So India has now more than 180,000 Ayushman Arogya Mandirs. And we have developed modules called MNS, Mental Health, Neurological and Substance Abuse. Every CHO, community health officer, or the people who work at the Ayushman Arogya Mandirs, CHCs or PHCs, two different kinds of AAMs are there. So they are now trained to pick up red flags if somebody has at risk of developing severe mental disorder or neurological disorder or substance use. So now the bottoms-up approach is coming up that we are fishing at the bottom, at the Ayushman Arogya Mandirs, where the patients can be referred to the appropriate level, whether it is district hospital or it is in the tertiary care centers. Now coming to the what has been done, is we all talk about there's a problem, there's a problem, there's a problem. But we are also doing a lot of things on this aspect. If you see the recent budget, I wrote in Hindustan Times the opinion editorial. This is the first time in the history that the budget has so much of emphasis on mental health. The budget paragraph 87 and 89 and 90 clearly states that we need to have a NIMHANS 2 in the northern India. So NIMHANS is in Bangalore is a big mental health brand, which recently got WHO award also. So north of India, we don't have any such tertiary care, the world leader in the mental health. So we are going to have the NIMHANS 2 in the northern India, hopefully in Delhi or somewhere nearby. So that is the first time the union budget has come up with these things. Not only this, they are upgrading the central mental health institutions in Ranchi and Tezpur. The India has around 45, 46 mental hospitals also, including Amritsar, Agra, Gwalior, Bareilly, all these things. So they are being upgraded. They are also increasing the budget for the manpower development, for creating center of excellence in different medical colleges and hospitals. They are also investing in the district hospitals. The Niti Aayog has come up with the National Task Force on Brain Health, which I am the chairperson. And we have started in 12 districts of India, 2 in north, 2 in south, 2 in east, and 2 in west, and 2 in central part of the country, where we have district brain health centers, including the mental health, which is being manned by psychiatrists or a neurologist. So this is a pilot project which the Niti Aayog has given 1 crore from the government of India to each center. So if this pilot become successful, this will be rolled out in 760 districts of the country, which will be huge step to create mental health ecosystem and the services which would be accessible, available, affordable, and adaptable to society.
You know, we've got a message from the Honorable President of Guyana. We'll play that out, but before that, I want to ask both of you, how much of this impacts? Dr. Nagpal, you said that, you know, there's a fashion of having double income and no children, and, you know, there's loneliness, and people want to, they're aspiring higher and higher for themselves professionally. And India is an aspiring country. It's an aspiring economy. We've had a history of colonialism. We got our freedom, and now people want their standard of living to increase. In that scenario, how do you then, you know, tell them that, look, aspiration is one thing, but you have to balance out your mental health as well? Because, you know, there will be people who say that, look, we want to enjoy what we earn. We don't want to be limited to responsibilities of life.
What a philosophical question, actually. Wonderful. The time to decode, I think, I'm sure some of the learned audience will have answers to this. Only yesterday, we were having an online meeting with some school principals, and children are asking these questions, jo aap pooch rahe hain. Can you tell me the difference between happiness and success? Can you tell me what is materialistic success and what is emotional success? That means the doubts are coming to young ones also. It's not about you and me and all of us here. Aspirations will remain, but aspirations for what? Agreed, financial literacy and financial backup is the most important survival mechanism, even if I'm aspiring to be in the best of the institutions and best of the jobs. But what is happening, and evidence has come for that. Evidence is happening that while we are skyrocketing into, I would say, target, attainment-oriented, achievement-oriented life, targeted to achievement and attainment-oriented, which is fine, needed. One cannot, wait for basic finances and talk of happiness, right? We are not yet Bhutan. But on the other hand, the fallout, the tangential fallout has been simultaneously in the urban world, the pandemics of loneliness coming in. There is enough data India can boast now. I'm very happy you mentioned, ma'am, colonialism से बाहर आ गए हैं. हम वेस्टर्न डेटा के लिए नहीं वेट करते हैं हमें समझाने के लिए कि हमें क्या करना है. We have our own data now. NCRB survey, NCRT survey, NMHS survey, ICMR survey, economic survey. 5 fantastic Government of India surveys telling us कि mental health के लिए कुछ करना है. करना ये है that हम जो भी aspirations हैं उसको साथ लेके चलें. If I'm competitive to earn a given amount or maybe get a placement after IIT, IIM into Microsoft, Apple, Adobe, anywhere in the world, simultaneously, can I be enlightened or get myself enlightened about personal, family, social, physical, and my own mental health? So this remains a question because it has its own answers. We see, the answer was in the previous question you asked us, the fallout on non-communicable disorders is highest in the urban India then. So-called most successful, highest educated India, having the highest amount of non-communicable disorders including mental health. क्या ये paradox acceptable है हमें? It's an irony, no? I'm the most successful CEO of the country. But I yesterday had a stenting with 2 stents, right? My teenager doesn't want to remain with me. My wife is waiting for me throughout. Whatever may be. I'm just telling you anecdotes which come every day to all of us and papers also. So it is, this answer may not come only from me. But I'm so gradually turning into a social psychiatrist because I'm realizing कि ivory towers में हम भी नहीं काम कर सकते अब. वर्टिकल्स में बैठ के खाली जो हमें सिखाया गया था 10 साल की एजुकेशन में कि डायग्नोज करो, दवा दो, काउंसलिंग करो और छोड़ दो. आई एम सॉरी, आई डोंट थिंक आई मेड फॉर दैट. आई मेड फॉर helping families to understand that let's go beyond conventional therapy. And therapy is, I insist, by a norm, which I think, Professor, we have discussed a lot together whenever we've gone. I have watched out for a pillar in the family when they're all sitting in front of me. एक खंबा चाहिए जो पूरी परिवार को रोक सके बिखरने से, और वो कामयाब होता है. अदरवाइज आई गो वेरी हेल्पलेस कि भाई समझ नहीं आ रहा, आप लोग सारे परेशान हैं, सारे गिरे हुए हैं, सारे एक तो चलो ताऊ मामू चाचू किसी बंधु को लेके आओ. एंड बिलीव मी, वी हैव प्लेंटी ऑफ सच पीपल इन आवर फैमिलीज. And let's not copy the West, because मुसीबत के time पे it is in India only that अस्पताल में भी 50 लोग खड़े हो जाएंगे, बाहर कहीं नहीं होता है, families नहीं आती हैं. So why first aiders cannot be? First aiders in mental health are relatives, friends, colleagues. First aiders क्यों नहीं तैयार हो रहे हैं? Second part, what you were asking, the financial race, the best answer has come from IITians. They are the brilliant people. I was in IIT Bombay, sir was in IIT Gandhinagar with me, and we went to IIT Ropar, we went to IIT Kanpur. Everywhere the conversations are with the most brilliant young people in the country. And what you know what they're saying? We wish to talk about well-being, but we are pushed, pressured to the idea of getting the best jobs in the world. But their heart still lies in these conversations. हम उनको छीन रहे हैं वहाँ से. And that is what they repent later. Haven't you come across so many cases of self-shooting in California, Indians, so many of them, best placed people in the Silicon Valley. My own cousins who are there, वो मेरे से सलाह लेते हैं रात को, हम depressed feel कर रहे हैं, मैं बोला वापस आ जाओ. Money is not a problem there, no? Here also. So I think this is a question which you asked, very relevant, not only for Dr. Nagpal, I'm sure. This is for all of us to answer as India's future. Because our children will ask this question when they grow up in 2047. With Prime Minister says, Viksit Bharat, कि सिर्फ मुझे जॉब के लिए तैयार किया था आपने, सिर्फ काम के लिए तैयार किया था, लाइफ के लिए तो तैयार किया नहीं आपने.
Yeah, so introspection, I believe, Dr. Nagpal, is needed. We need to set our priorities of where our focus lies. But quickly, let me also play out the message from the Honorable President of Guyana, what he has said.
Distinguished ministers, healthcare providers, researchers, physicians, and other participants of the WION Healthcare Summit. I bring you warmest greetings from the Cooperative Republic of Guyana. Permit me at the outset to extend my very best wishes to all who are participating in this important summit. It is a pleasure and an honor to be afforded the opportunity to address you remotely and to join this distinguished gathering of minds committed to advancing the future of healthcare. This summit convenes at a defining moment in human history when technology, innovation, science, and human ingenuity are converging to transform the way healthcare is delivered across our world. Indeed, there could hardly be a more fitting example of this transformation than the historic event in Guyana that recently captured global attention. That event was the groundbreaking, longest distance cardiac telesurgery ever performed. From within Guyana, renowned Indian cardiac surgeon Dr. Subir Srivastava successfully conducted a coronary artery bypass craft procedure on a patient located thousands of miles away in India. In doing so, he set a new world record for the longest distance telesurgery ever performed. This sort of removal procedure used to be the stuff of science fiction. Today it is a reality and is allowing us to break down barriers of geography. Think about what this means for medicine, for a surgeon in one continent to perform a procedure on a patient in another country, thousands of miles apart. In terms of healthcare, technology is rewriting geography. For generations, access depended on where you live. Today, access increasingly depends on what we are willing to imagine and build together. That remarkable surgery was not simply a technological achievement. It was a glimpse into the future of healthcare. It was a demonstration that medicine is entering a new era, an era where expertise can travel faster than airplanes, where knowledge can move instantaneously across borders, and where the best care need not be limited by physical location. It also points directly to the direction in which healthcare in Guyana is proceeding. Guyana is undergoing the most ambitious healthcare transformation in our history, and I dare say, in the history of the English-speaking Caribbean, working in partnership with countries across the world, including India, and collaborating with world-class healthcare providers and institutions.
Well, Thank you to the Honorable President. And with that, I'm going to wrap this very intriguing session up. But before we go, we're all very religious, very spiritual in this country. Closing remarks, and very briefly, does that help in, stabilizing and balancing our mental health? A little spiritual inclination, the belief in God and such rituals, perhaps, in our daily lives.
So before I answer that, I just want to sensitize this is international platform, the WION, and having this kind of a summit, health summit, is very important. So what the new concept is a brain economy. The brain economy, brain skill and brain capital. That means if your population is mental healthy or brain healthy, your GDP will increase exponentially. So $1 invested in brain health has a return of $11 in the productivity in the GDP. So this is something which is now happening at the global level. I was at the United Nations General Assembly in September last year and UNESCO recently, where everybody is talking about the brain health, brain economy, brain skill. Even McKinsey has now Brain and Mind Institute of their own. So that is something that is happening in the future. In the next 10 years, we will all be working towards making our population brain healthy and mental health healthy. Now coming back to your question about spirituality and the religion, of course the meditation, calm downs, everything helps in making you more healthy in terms of your brain capacity and brain chemicals. With even exercise, now walking is a new medicine, sitting is new smoking. So that is something which we need to be careful, and everything in moderation is helpful. Okay. Excessiveness of religious, I'm sure the psychiatrist friends will tell you, that is also a problem. But certainly, yes, to calm down, your pranayam, your meditation, your yoga, and your faith, which is very, very helpful.
Dr. Nagpal, closing remarks, very briefly, please.
Yeah, I think very pertinent question, because one that we'll all agree that there is a very subtle blurred line between being religious and being spiritual, and we all know that already. Being spiritual is part of being a balance, being into a workable balance in daily life, so that I can be aware and responsible for physical, mental and social aspect of my health. Is that okay? A balance. Religious, well, up to each one's own ability and need, we can have a faith in a power. It could be God, it could be any other power. And I think that serves as a great anchor for a sense of direction in life and a sense of confidence in life. Why not? Whatever I believe in it, whoever is my faith, it could be, India has many gods, we can believe in those. Third part, very importantly, when we look at revision of the whole idea about mental health, do you know that after pandemic, the definition was revised, and today mental health has 4 components. It's not about at all absence of any symptoms. I'm not healthy mentally if I am having no symptoms. I'm mentally healthy only if I am able to deal with daily challenges of life, nominal daily challenges, बच्चों से लेके बड़ों तक. Second part, am I able to contribute productively and effectively to the environment? We didn't know that. That's mental health. In between, there's another one, which of course, am I able to live to the best of my abilities on a daily basis, whether at school, university or workplace? So 3 parts constitute WHO's revised definition of health, which takes a ecosystem approach, which includes our spirituality also.
I'll just conclude by saying that in India, health is not a right, but mental health is a right. So we have a Mental Health Care Act 2017, which guarantees that you have an access to the mental health. So mental health is a right.
Oh, this is fantastic.
Yes,
I think a lot of us didn't know that.
Yes.
So thank you for that. I'll wrap it up here. Ladies and gentlemen, can we have a huge round of applause for Dr. Dhamija and Dr. Nagpal, who've been candid. They've been very, honest with us as far as mental health is concerned. Thank you very much, Diksha.
Well, thank you so much, Dr. Dhamija and Dr. Nagpal, for that thought-provoking conversation. May I please request Shreya to bestow our guests with a small token of our appreciation.
I was just asking Dr. Nagpal whether doctors and psychiatrists go through mental health issues or it's just all of us menial beings. But he said yes, he did, and he overcame that. So thank you so much once again to both of you.
And on that note, ladies and gentlemen, it's time for a short break. On the other side, we have two fantastic sessions lined up. One exploring the future of AI in healthcare, and another examining the delicate balance between care and cure. We will also be honored to welcome our chief guest for the day, Dr. Jitendra Singh, Union Minister of State, Independent Charge for Science and Technology and Earth Sciences, who will be joining us for a special address at 1:45 p.m. sharp. Lunch is served at Mansingh Hall number 3. Please enjoy, recharge, and join us back here at 1:45. Thank you.